Hi, this is Dr. Chan with Crown Dentistry. We've been getting a lot of questions about dental implants, so today we're going to talk about them and hopefully we can give you a better understanding of what dental implants are all about. So dental implants are one of the most exciting new tooth replacement options that we have in dentistry today. Before implants, pretty much the only options for replacing teeth that were missing or broken were either bridges or dentures. Those works, and they still do continue to work, but we're really excited about what dental implants are now. So what dental implants are a new restorative option that basically allows us to put a tooth where there weren't any teeth before. What the dental implant does is it goes into your jawbone and it basically takes the place of the root of the tooth. Then, after the implant has been stabilized and is healed inside your jawbone, we make a tooth, basically a crown, that fits on top of that implant, and basically it gives you a new tooth. So what we want to make sure that we remember is that your mouth needs to be healthy, at least as healthy as possible, in order to make sure we make the dental implant as successful as possible. We want to give it the best chance to stay in your mouth for as long as it can. So it's really important to make sure that your mouth is healthy, but also to make sure that your body's healthy. That's why we're always asking our patients, have you been to your doctor recently? Have you gotten checkups? Have you gotten your physicals? Are you getting your blood checked just to make sure cholesterol's good, blood pressure is good? Just make sure that if you do need any medications to help you control any other outside illnesses such as diabetes, high blood pressure, any heart issues, you want to make sure that you're getting the care you need even before you come into the dental office, so that when we work to make your smile and your mouth as healthy, happy, and as beautiful as possible, that we're giving it the best possible chance to succeed. So some dentists place mini implants, which is another option that basically can be used sometimes by certain dentists. Mini implants are another restorative option that allows us to replace teeth. Usually mini implants will be used to replace and hold basically like a full denture in your mouth. A lot of times dentists will place at least usually a minimum of 4 to 5 mini implants. These are screwed into your jawbone, and then a denture is attached to these mini implants. In comparison to full implants, mini implants tend to be a little bit smaller, basically a little bit narrow, also a little bit shorter. These mini implants tend to be a little bit less expensive than full implants. Some of the downsides of mini implants is that they don't last as long. Usually mini implants have a lifespan on average of anywhere between 5 and 8 years. Full implants, if they're done properly and the patient is healthy, can have lifespans of anywhere between 10 and 30 years on average. So one of the main advantages of full implants is that they do tend to last longer. They do tend to look better, just because when you put a mini implant in, sometimes an option for a single tooth isn't going to be quite as aesthetic. You just really can't get the appearance of a mini implant to look quite as good as a full implant. So when we are talking to one of our patients about are they a good candidate for implants, first we want to talk to them about their health. We want to review their health history. We want to just talk to them and see where they're at in terms of what they want for their mouth, and if dental implants are really a good option for them. Once we've determined that, yes, they are healthy, they're motivated to try and keep their teeth in their mouth as clean as possible, then we make sure that the areas where they want the implants are actually good areas to place the implant. What I mean is that, is there enough bone? Is there enough gum support? Are we able to actually get an implant to fit in the area that needs it? In order to determine that, we'll do a visual exam. We'll basically look in your mouth and see what's going on. We'll also want to take different scans, x-rays, as well as what we call cone beam x-rays, basically images of your entire jaw to make sure that there's enough bone structure there to properly and securely hold the implant in your mouth. Once that's all determined and we look at that and we examine that, then the actual implant placement surgery will take place. Usually we'll anesthetize the area that needs to receive the implant. The implant will be placed, and more often than not, some sort of basically a cover screw, something to kind of protect the implant, will be placed on top, and then the patient will go home to be healed. Sometimes if the implant is in an area that's a little bit more visible, we'll also make some sort of retainer or a temporary denture with either one or several teeth in order to allow you to complete your smile so that you don't have a hole in your smile while we're waiting for the implant to heal. After that, after a couple months, usually it takes a couple months for the implant to become solid and stable in your jaw. Once we've determined that that is the case, then we can go about making the actual crown, the tooth, to fit on and be attached to the implant. And then once that's made, it's attached and you can go home with your new tooth. So as we had mentioned before, average lifespan of the dental implant is anywhere between 10 and 30 years. I know that's a really wide range, but a lot honestly depends on the individual patient. Just their own home care. Are they being good about brushing, flossing? Do they have a good diet? Are they, staying up on just getting enough protein and calcium and all the vitamins they need? Are they minimizing the amount of junk food that they're eating? Sugar, excess fat, all those kind of things. Those things actually still play a role in not only how healthy your body is, but also how healthy your mouth is. The healthier your mouth is, the longer the implants are going to last. Also, we want to make sure that we're seeing our patients on a regular basis, at least once a year, ideally even more, maybe twice a year, just to make sure that things are healthy, happy, and clean, not just at the site of the implant, but also in their mouth.